And finally, we're going to move to Dr. Micaela Martinez, who is an ecologist, an activist, and she serves as the director of the environmental health at We Act for Environmental Justice. Dr. Martinez?
Yes, thank you very much. Next slide. So the question that I want to address today is, how does environmental racism impact brain health? Next slide. And so what I want to focus on are examples of how structural racism can impact exposures to neurotoxins. And so what do I mean by structural racism? Structural racism encompasses many aspects of our society: community disinvestment, redlining, which we've heard about a couple times, subpar schools and healthcare, the homeownership gap, and all of these things come together to form cumulative impacts. And so structural racism overall is this set of mutually reinforcing inequitable systems that essentially oppress a large group of individuals in our society while simultaneously elevating other groups of individuals. Next slide. And so the two exposures I want to talk about today are lead exposure and mercury exposure. So lead exposure, how does this happen? So lead exposure often occurs through lead paint in homes. And so lead paint was often used in homes that were built prior to 1978. And many homes today, unless they've gone through lead paint remediation, still contain lead. And then there's also lead paint exposure that can occur through lead paint on toys that are being imported from other countries. We also have old lead pipes in many cities that can also be a basis for exposure. Next slide. And what we see is that across the United States, there continues to be a racial and socioeconomic disparity in blood lead levels in children. And so these are based on data from 2011 to 2016, where children from ages 1 to 5, their blood lead levels were measured. And what we see is a 1.35 times higher blood lead level in Black children compared to white children. Now, lead, because it is a neurotoxic heavy metal, there is no safe level of lead. And even small amounts of lead exposure can be harmful to children and can affect their developing brain. Next slide. And the other exposure I wanted to talk about was mercury. So mercury is often used in skin lightening products, which are very common in the United States. Here on the right is a picture that I took of one of the beauty supply stores, which is down the street from my home in Harlem, which is in Upper Manhattan. And you can see a whole diverse array of skin lightening products, some of which have had measurements taken, and we can see in the scientific literature that they're known to contain mercury. So mercury is used in skin lightening products because it is a very effective blocker of melanin. But mercury, because it's a neurotoxin, can be incredibly harmful, not only to the individuals who are using these skin lightening products, but because mercury can vaporize and it's odorless and colorless, it can also expose an entire family. Next slide. And so We Act for Environmental Justice, which is an organization that I work with, did a survey of 297 women of color residing in Upper Manhattan. And this survey was just recently completed. And what we ended up finding was that 25% of all women surveyed use skin lightening products at some point in their life. And 57% of Asian respondents use skin lighteners. So this shows that these products are not only prevalent in our stores, but they're also very widely used. And there's also a psychological and social harm that comes along with the marketing and use of these products, because these products are grounded in Eurocentric beauty standards and white supremacy. And so respondents who thought that other people believe that lighter skin makes women look more beautiful or younger were much more likely to currently be using skin lighteners. Next slide. And so the take-home message from this is that these neurotoxins, which are highly damaging to the nervous system and particularly the developing brain of children, are disproportionately experienced by communities of color. And this has to do with marketing of toxic beauty products to communities of color. This also has to do with housing disparities and people of color being more likely to live in homes that have housing defects or lead paint. But there's a co-occurrence of these exposures, and these exposures also co-occur with other toxic stressors that can amplify susceptibility to disease. So the picture I want you to walk away with is this one here on the left, where you have the burden of environmental racism being carried on the backs of communities of color. And we can go to the very final slide now that my time is up. And I just wanted to say that We Act for Environmental Justice has many policies that are addressing structural racism and environmental racism, including the Safer Beauty Bill package, which is targeting toxins in beauty products, and the Lead Service Line Replacement Project, which is targeting lead pipes. Thank you.
Thanks so much, Dr. Martinez.